Sleep is a big topic these days. Turn on the TV or radio and you'll probably hear someone discussing sleep medicine. There have been broadcast several conversations about sleep recently on topics ranging from surgical options to sleep-inducing drinks. And books are being written every day on sleep topics as well as ongoing articles in national magazines, particularly on the subject of snoring. For many years this has been regarded as strictly a male preserve, but the emphasis has started to shift recently. In fact, half of all the women given overnight sleep tests for a new study were found to have mild to severe sleep apnea, a staggering percentage. Obstructive sleep apnea is a serious snoring disorder in which the sufferer stops breathing during sleep for at least 10 seconds. It's generally associated with men, but researchers in Sweden recently set out to determine the frequency of the problem in women. The results were surprising. Half of the women in the study experienced obstructive sleep apnea, with 20% having moderate and 6% having severe symptoms. The report has been published in the European Respiratory Journal and was based on women between the ages of 20 and 70 from a large population sample of 10,000. The participants of the study were monitored during sleep for heart rate, eye and leg movements, blood oxygen levels, airflow and brain waves. Half experienced at least 5 episodes an hour when they stopped breathing for longer than 10 seconds. And for women with hypertension or who were obese, the numbers reached as high as 80 to 84%. The results were very clear-cut and seemed to have started many alarm bells ringing. It was important enough to have been picked up and covered by the UK national press, including the Daily Telegraph and the Daily Mail. Age played a big part, and the disorder was found to be more prevalent in older women. Among women aged 20 to 44, 1/4 had sleep apnea, compared to 56% of women aged 45 to 54, and 75% of women aged 55 to 70. Occasional cessation in breathing during sleep may happen to everyone from time to time, but in obstructive sleep apnea there are at least 5 times when breathing stops for at least 10 seconds, each time within an hour. Patients with really severe symptoms may stop breathing hundreds of times in one sleeping session. Sleep apnea is a serious health problem and is tied to a higher risk of depression, stroke, heart attack, cancer and early death. Importantly, it can be minimised or even eliminated by simple anti-snoring devices such as mouthpieces worn at night. Many patients are not aware of their sleep disorder, and knowing these symptoms can often help. Excessive daytime sleepiness, loud snoring, which is usually more prominent in obstructive sleep apnea, episodes of breathing cessation during sleep that is witnessed by another person, abrupt awakenings accompanied by shortness of breath, which are more likely to indicate central sleep apnea, awakening with a very dry mouth or a sore throat, a morning headache, difficulty staying asleep, attention problems during the day. In some occupations, particularly when driving or being in charge of any machinery, sleep apnea is extremely dangerous due to the possible lack of attention or even from falling asleep briefly. Another recent study also found that women who have sleep apnea are more likely to develop memory problems and dementia. One piece of important advice: do not ignore it. If you suspect problems, take advice from your GP, who may even ask you to attend a specialist NHS sleep centre for further tests and confirmation of the symptoms. Act now, because it will not go away. It will simply get worse.